Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about Achilles tendinitis. So the Achilles tendon actually sits on the back of the leg. It goes from the knee to the heel bone, and it attaches right in that area. And one of the common problems that we have is Achilles tendinitis. So I'm going to go through those 4 questions again, and I help you understand exactly what's going on. So number 1, what is Achilles tendinitis? Achilles tendinitis is an inflammation of the Achilles tendon. Usually does not indicate injury, usually doesn't mean you have any tears or anything like that, but it's just an inflammation in the swelling of the tendon. And it can be pretty painful. It usually can occur right at the heel, right where the Achilles tendon attaches, or it could be just above it in an area that we call the watershed area, which is not right at the bone, but closer to the ankle joint itself. So Achilles tendinitis. Number 2, why does it happen? The truth is, an Achilles tendinitis happens usually from an overuse. You're actually overusing that tendon, whether it is you're wearing a shoe, for example, that has a negative heel. So instead of being flat, it's actually negative, and you're actually stressing that tendon too much. If you have a tight Achilles tendon, say you wear a lot of heels and stuff like that, and then you go into a flat shoe or barefoot, you can actually create an Achilles tendinitis. You've done a long walk or a long period of exercise, that can create an Achilles tendinitis. Or you could actually do an injury. Maybe you strained it, and because of that, you get a swelling around that tendon and causes an Achilles tendinitis. Any of those causes can actually lead to significant discomfort and pain in that Achilles tendon. The truth is, it's commonly going to be caused by the way you walk. Age actually does play into it, and the amount of activities. If you're going from minimal activities to significant activities, that does increase the chances. Number 3, how do you treat it at home? With an Achilles tendinitis, it's an inflammation. So you're going to basically treat it like you would any other inflammation. You're going to decrease the swelling, which ultimately will decrease the pain. Ways you can do that: ibuprofen or anti-inflammatory type medications. You can do topical anti-inflammatory medications also. You can do ice. Ice is very effective at decreasing the inflammation and limiting activities. If you don't keep stressing that, the inflammation can go away. So that's usually the way people will treat it at home. When should you be seen? If the Achilles tendinitis is not improving, or it continues to get worse, or it's starting to interfere with your lifestyle, then it's worth going and being seen. There are other things that can be done, whether it's completely immobilizing you in a boot or something like that, whether it's doing a little bit of a heel lift, which takes the pressure off that Achilles tendon, or physical therapy, or there's a form of laser that can actually decrease the swelling in that area. The truth is, it should be seen if the home treatments are not helping, or it's continuing to get worse, even though you're trying to be careful and trying to do what you're supposed to do. So this is Dr. Brandt Gibson. This is your Podiatry Tips, day 164, Achilles tendinitis.